Hello and welcome to our final surgery coding review. Today, we're going to focus on the 60,000 series of codes, which actually begin on page 408 in your 2020 CPT code manual. Now, what's interesting about this family of codes is that it kind of just appears immediately after maternity care and delivery. It's literally that 59899 ends, and then there you have the endocrine system. And I know that most of you are probably thinking that you're used to kind of the next series of codes being, with the first page kind of right there so you can see it. All right, so the 60,000 series, starting with the endocrine system code 60,000 through 60699, not a lot of codes that we have to look at. And we're first going to explore procedures on the thyroid. So this section starts off with an incision and drainage of a cyst, and then we have a biopsy code, percutaneous needle core. And after that, we get into an excision of a cyst, and then finally, partial thyroid lobectomy. And our lobectomy actually has two procedures that, or two options, I should say, that you will see available. So a lobectomy is known as a partial procedure because they're just taking out part of a lobe. Now, when you get down to 60220, then you see a total thyroid lobectomy. And so now you see the difference. One is partial and one is total. And then both of those have two indented codes which are related to contralateral subtotal lobectomy, including an isthmectomy. Now, immediately after that, at 60240, this is where you have full-blown thyroidectomy procedures. Now, what you want to pay close attention to are the words partial, total, what they actually took out, what type of approach was involved in the procedure, because that is going to impact your code assignment. And now with the thyroidectomy procedures, what I want you to notice is that they include the word total or subtotal. And what that means is subtotal is meaning like less than total, because the word sub means under or below. So you want to make sure that you watch out for that wording. And then this particular section ends with an excision of a thyroglossal duct, cyst, or sinus. Now, what's interesting, if you go back over to an incision, it starts off with an incision and drainage of a thyroglossal duct. So very important to pay close attention to the wording that a particular code family may include. All right, next up, we're going to go over to parathyroidectomy. And for parathyroidectomy, we're on page 409. And the first three code options that are available, you'll notice that they say parathyroidectomy or exploration of parathyroid or roids. Very important. Now, then you'll also note there's an option for re-exploration, and then you have an option for a mediastinal exploration in 60505. All right, and then after that, you have options for a thymectomy. I don't know if you're noticing this, but it's so important to actually know what's being removed, because that's going to impact your code assignment. Next up, on page 410, we have our adrenalectomy codes. And what you'll notice here, we have two options. The first one is listed as a separate procedure, By now, you should be familiar with the concept of separate procedure. And then that second code, 60545, is for an excision of an adjacent retroperitoneal tumor. You can see now, as you are at the end of the surgery section, why it's so important for you to pay close attention to those little details, because it's those little details that are going to impact your code assignment. Now, I want you to notice on page 410, on the left-hand side, you have our open adrenalectomy procedures, but in 60650, there is an option for a laparoscopic procedure. And what you will just want to remember is that there are key words that you want to look out for that help you determine that a procedure was open versus endoscopic. All right, well, that's all for the nervous system, short and sweet. Next up, we have in the 60,000 series, we have our nervous system, which starts on page 411. The anatomical sites for the nervous system include the skull, meninges, and brain, the spine and spinal cord, the extracranial nerves, peripheral nerves, and autonomic nervous system. And that's it. So let's start over on page 414, where we have the skull, the meninges, and the brain. So what you're going to see here, first up, are procedures for injection, drainage, or aspiration, followed by twist drill, burr holes, or trephine. So those procedures are for conditions that require opening into the brain and openings into the brain to relieve pressure. They can also insert a monitoring device. They can place tubing as well as inject contrast material. Now, next up, immediately after that, under skull, meninges, and brain, we have lots, and I say lots, of craniectomy or craniotomy procedures. So those are codes 61304 through 61576, which goes over to page 416. So these procedures here deal with an actual incision of the skull, and sometimes requires them to remove a portion of the skull so that the skull is open to the physician's naked eye. They're going to use specialized tools to remove a section of the bone. They call it a bone flap, and you can actually see that in this diagram. And that bone flap is actually temporarily removed, and then it's replaced after the surgery has been done. Some of the craniotomy procedures may use the guidance of computers or imaging guidance such as MRI or CT. And what you'll want to note is if that radiologic guidance is included in the code or if it's something that you can code separately. And by now, you know the key is in those parenthetical notes. And sometimes they have to do a procedure such as stereotaxis, and there are some code options in this section for that type of procedure as well. I encourage you to explore the different craniotomy or cranioectomy codes, because you're going to see the different things they can do. And you want to pay special attention to body parts, because that's going to impact what the code assignment is going to be. Next up on page 416, we have what's known as skull base surgery codes. Now, the skull base is the area at the base of the cranium, and this is actually a very complex procedure because the doctor is trying to go in and remove some type of lesion. So The procedure codes that we have available are divided into what's known as the approach procedure, and that is what's done to gain exposure to that lesion. Then we have the definitive procedure, and that's what's actually done to the lesion. So approach, they got to get in there. Definitive is what they do. And then we have repair and reconstruction procedures, and that's what's done for closing up the area. And in the subsection notes, it's worth noting that repair and reconstruction is reported separately if extensive dural grafting, also known as cranioplasty, just to name a few, is actually performed. Now, of note, this procedure often involves specialists working from more than one area. And so the approach and a definitive procedure possibly are done by two separate providers. And so what you want to do is, of course, see who you're coding for and then code the services that they have provided. On page 417, what you're going to see are first the approach procedures, and the approach procedures are divided based upon if it's the anterior, middle, or posterior cranial fossa. Then you have the definitive procedures, bottom right hand corner of 417. Remember, definitive is actually what's done to the lesion, and those codes are divided again: base, anterior cranial fossa, the middle cranial fossa, and then on page 418, you have the base of that posterior cranial fossa. Then we do have two code options for that repair and reconstruction surgery. All right, next up on page 418, we have the endovascular therapy codes. And with endovascular therapy, instead of actually opening the skull to treat the neurologic problems, the surgeon actually does a puncture of a blood vessel in either the leg, the arm, or the neck to gain access to the patient's body system of arteries and veins. And then using a tube called a catheter, the surgeon actually navigates their way to the problem area. And of course, they're going to have X-ray technology for this, a high resolution screen, and to treat whatever occlusion that has been, or what vessel has been occluded. All right. You will note on page 418, there is a parenthetical note that identifies that if radiological supervision and interpretation was performed, that you want to capture that with an additional code. And this is the name of the game with CPT codes. Either the radiologic guidance is included or it's not. And CPT does a great job of letting us know when it's included, and a lot of times it's included. But here is an example where it's not. Also, for this type of therapy, they can do a balloon dilation, so you'll see some code options for that. And between pages 418 and 419, you see lots of subsection notes. All right, next up on page 420, we have intracranial arteriovenous malformation surgery. And an arteriovenous malformation is where there's an abnormal connection between an artery and vein in the brain. And if they rupture, they can cause bleeding into the brain or the spinal cord. So, of course, this procedure is to correct those problems. And on page 420, we start off with some surgery of intracranial arteriovenous malformation codes. And what I want you to note are words like supratentorial or infratentorial. Medical terminology here, very, very important. You also are going to note that some of the codes are divided based upon if the procedure is simple or if the procedure is complex. All right, next up, bottom of page 420, right-hand corner, we have what's known as SRS surgery, which is our stereotaxis surgery. And this is actually, as you can see in the picture, is a non-surgical radiation therapy that is utilized to treat functional abnormalities and small tumors of the brain. This particular procedure can deliver precisely targeted radiation in fewer high dose treatments as compared to traditional surgery or traditional therapy, which can preserve healthy tissue. So on page 420 and 421, you have codes for stereotaxis as well as the stereotactic radial surgery. And of course, you guessed it, guidelines, guidelines, and more guidelines. All right, on page 422, we have codes for intracranial neurostimulators. Neurostimulator actually is utilized in several areas of the surgery section. This particular one here has to do with intracranial. So this is a treatment for a patient that has advanced pain. And so the codes that you are seeing here are going to go back to some terms you just saw, twist drills, craniotomy, craniotomy, burr holes, and that's the approach to getting these devices implanted. All right, next up, we're going to go over to page 423, and here we're going to be looking at cerebrospinal fluid shunt. This particular procedure is done to drain fluid, and the codes that are available on 423 and 424 are going to describe the placement of devices, also repair, replacement, and removal of the different shunting devices. Okay, next up, we're going to go over to spine and spinal cord. Now, this is where it gets just a little bit complex, and probably when you're looking at the subsection notes on page 424 and 425, you're like, wow, yeah, there's a lot of information there. So, with the spine and spinal cord procedures, one of the things that you want to note is that the surgical component of the services that you're going to see in this code family are going to be presumed open unless otherwise noted. Other options that are available are percutaneous, endoscopic, indirect, and direct visualization. Our spinal injection codes, which is what you're looking at here, are divided based on the specific spinal anatomy, such as subarachnoid or epidural. They're also divided based upon the levels. And the levels, think back to anatomy, but those levels are cervical, thoracic, lumbar, sacral. And then they're also divided based upon the type of substance that was injected. Now, you probably have heard me mention before that pharmacology is actually something important for coders to know. And so that's why when you see a new drug or a new term that you're not familiar with, if you look it up, it'll go a long way in helping you understand what you are reading. Now, as you start to explore the codes on page 425, in addition to the anatomy, the levels, the types of substances. Oh, I didn't mention the type of substances. Those substances can be, and you can see them actually over on 424, 425, 426. But those substances could either be a neurolytic, an opioid, an anesthetic, a steroid, or an antispasmodic substance. Now, the other thing that you're going to note here that you'll want to pay close attention to, so if you start turning over to page 426, 427, it's important to note the time and complexity of the services with regards to single versus continuous. You also, in this particular, and actually in the neurological section, you also are going to see things like different substances, different regions. And so you really just want to make sure that when you're reading the report, as it relates to the time spent and the complexity, that it's clearly reflected when you're selecting a code. Some of the codes will say things like multiple sessions, 2 or more days, and some don't have any time and complexity reflected at all. You also are going to see things like simple or multiple levels. So again, you got to pay close attention to what's actually documented in the note, and then you can go from there with your code assignment. But this is an area that I think is somewhat complex. Probably not as complex as cardiovascular, but maybe somewhere very close. All right, next up, we're going to go to page 429, and we're going to look at laminectomy codes. And laminectomy codes, it's actually kind of a lot of them. This particular code family does start off with subsection notes. Here again, the services that are reflected here are open unless otherwise specified. Other approaches can be percutaneous, endoscopic, open, and then of course we have terminology of indirect and direct visualization that you need to be familiar with. So a laminectomy is a surgical procedure that removes a portion of the vertebral bone called the lamina, henceforth the word laminectomy. The back muscles are actually pushed aside rather than cut, and then the parts of the vertebra that are adjacent or near to the lamina are left intact. So on page 429, you're going to see our different laminectomy codes. Please note, in the neurological system in general, watch out for the levels. Levels meaning cervical, thoracic, or lumbar. Very important. All right, over on page 436, we're going to skip a couple of those laminectomy codes. There's some more on page 432. But on page 436, we are going to see a new anatomical family, so extracranial nerves, peripheral nerves, and autonomic nervous system. And here we have codes for introduction, injection of an anesthetic agent. Remember I told you you got to watch out for the different agents. So here we got a lot of stuff going on. So first up, we have on page 436 our nerve block codes. And nerve block codes are actually 64400, turn the page over to 64454. Nerve blocks are used for pain treatment and management. Next up, of note, there's a really cool table on page 437 that you want to take a look at. So next up after that, I want you to see, let's see. Um, 64479, so much on this page, 64479. Those are codes 64479 to 64484. Those are codes for epidural steroid injection, and those are actually performed to reduce the inflammation and pain that is associated with nerve root compression. Then, bottom right-hand corner of 438, we have our TAP block procedure codes, and TAP is a transverse abdominis pain. And this TAP block is actually a peripheral nerve block that's designed to anesthetize the nerves that are supplying the anterior abdominal wall, T6 through T1. So those are our codes there. Then on page 439, We got some other blocks, and these are called facet joint blocks. In the description of the code, you'll see it's called paravertebral facet, but we call them facet joint injections. And a facet joint is really like this small stabilizing joint that is located between and behind the adjacent vertebra. So these injections are minimally invasive, non-surgical treatments that can help patients with a variety of neck and back pain. And the way that these injections work is that they are reducing the inflammation and irritation in the facet joints of the spine where the patient is actually experiencing pain. And this is a pretty common procedure that you see done by the neurologist. All right, next up, we're going to go over to page 441. And here we have destruction by neurolytic agent. Now, I've seen a lot of the families that I was just talking about a little while ago. So this is our neurolytic agent. So here, physician is performing a procedure called chemodenervation. And this is where they put Botox or a similar agent to treat focal muscle spastic disorders and excessive muscle contractions such as spasms or dystonias or twitches. With this procedure, the agent is injected directly into a neural substructure or muscle to essentially paralyze it and reduce the sensation of pain that the patient is experiencing. All right, next up, we're going to go down to the bottom of page 443. And here we have the beginning of the neuroplasty codes, and you can turn over to page 444. So neuroplasty is the surgical decompression or freeing of an intact nerve from scar tissue, including with this procedure, they can do external neurolysis, loosening, and or transposition. So on page 444, you see several neuroplasty codes, and you have heard of this procedure before. Patients that have carpal tunnel syndrome can get a neuroplasty procedure done. All right, so lastly, for the nervous system, we have neuroraphy codes. And so here we're on page 445. And neuroraphy is a surgical repair of a severed nerve. Now, as it relates to the different options, there are lots of options. And you'll notice they start off with the word suture because raphy means to suture. All right, next up, we're going to go to eye and ocular adnexa. So now we're on page 447. Our anatomic sites for eye and ocular adnexa include the eyeball, the anterior segment, the posterior segment, the ocular adnexa, and the conjunctiva. Starting on page 449, we're going to look at removal of the eyeball. Now, immediately, I want you to just remember, anytime you see a word that you don't know what it means, you need to look it up. While on some certification exams, they allow you to bring a dictionary, others they don't. So for example, the CPC exam offered by the American Academy of Professional Coders, you can't bring a dictionary into the exam. Whereas AHIMA's exams, you can. So if you're taking the CPC exam, which many of you are, it's going to be critical that anytime you see a word, you look it up. Now, reality is, if you don't use something, you lose it. But I want you to think about the fact that if you have looked something up, if you're looking at perhaps like a multiple choice question, having looked it up before, you probably can eliminate, if that particular word is or is not the option that you want to select. So there are 3 words I want you to pay very close attention to on page 449. First up, evisceration, code 65091. Enucleation, code 65101. And then extenuation, 65110. So evisceration is where they remove the contents of the globe, whereas enucleation, they remove the eye, but they leave the orbital structures intact. And then extenuation, that is where they remove the eye, the adnexa, and then part of the bony orbit. So with these procedures of note, as it relates to the extenuation procedure, there is a note that talks about if there is certain types of graft and use of those codes from the integumentary system, back where the surgery section began. All right, next up, we're going to look at removal of foreign body of the eye. We're still on page 449. This particular family, if you notice, it starts off with a whole bunch of parenthetical notes. So right there, that tells you must read those notes. So with this procedure, what I want you to notice first is code 65205 and 65235. 65205, 65235. Both of those say removal of foreign body. But what I want you to note is 65205 says external eye, whereas 65235 says intraocular. So one little word could make a difference in the code assignment. Now, with these procedures, the doctor is using like a microscope with a high intensity light source. That's what you actually see on this diagram. You can actually see the lighted source in the eye in this picture. And so the codes that you're going to see with this lighted source refer to a slit lamp. And so if you notice with code 65220, it's without a slit lamp. 65222 is with a slit lamp. So you want to look at your documentation to see if the physician is using this microscope, which again is called a slit lamp, and because that's going to impact your code assignment. All right, next up, we're going to go over to page 450 for procedures on the anterior segment, starting with the cornea. And here we have keratoplasty. Kerato also means cornea. And a couple of words you want to be familiar with as it relates to these codes. So they start with code 65710. So you want to be familiar with penetrating keratoplasty, which is a full thickness of the cornea removed, and then they replace it actually with a donor carrier cornea. You also want to be familiar with aphakia. Notice you see aphakia in a couple of the code descriptions. And aphakia is an absence of an eye. And then you also have pseudophakia. Remember, pseudo means false. And that's the presence of an artificial lens after surgery. All right, next up, we're going to go over to page 453 and look at the body part of iris, ciliary body. And here we're going to look for iridectomy. Iridectomy. That's code 6660000. Now, with the iridectomy procedures, you want to know what the doctor actually is doing. So if he's treating a lesion, that's 66600. If they are treating glaucoma, that's 66625 or 330. And if they're doing a procedure called photocoagulation, that's not even in this area. Notice it tells you to go over to 66762. So always, always, always read your parenthetical notes. All right, next up, we're going to go to cataract extraction procedures. We're on page 454. And there's a couple of things I want you to note first off immediately. And you might want to underline these words in your book. So I want you to look at 66982, and I want you to take note of the word extracapsular. Then I want you to look at code 66983 and look at the word intracapsular. Then I want you to look at 66984 and I want you to look at extracapsular. So extracapsular, also known as ECCE, intracapsular, ICCE. So extracapsular cataract extraction, intracapsular cataract extraction. All right, that's the first thing. The second thing in regards to 66982 and 66984, in 66982, I want you to highlight in the middle of that paragraph the word complex, because 66982 and 66984 kind of look alike. The difference is 66982 is when the patient has an extracapsular cataract surgery procedure that requires the use of equipment that they don't normally use. And in the code description itself, it actually tells you some of the types of equipment that they don't normally use and would use in this particular code, 66982. All right. Also, I want you to notice underneath 66982 and 66984, you also have some indented codes, and with those indented codes, what you have is with endoscopic cyclophotocoagulation. So if that is performed, you'll want to make sure that you select the appropriate codes. And these cataract procedures are actually very, very, very common. They're a result of the aging process. So if you work for this type of surgeon, this will be something that you'll be coding. All right, next up on page 457, we're going to look at procedures for extraocular muscles, also known as strabismus surgery. And this is a procedure that's done to correct muscle misalignment. So what you'll want to note here is that we have codes for horizontal muscles, that's 67311 and 67312, and horizontal, they're moving the eye side to side. Then we have vertical muscles, 67314 and through 67316, and that's for the vertical muscle where they're moving the eye up and down. The codes are divided based upon the type of repair and the number of muscles that are actually repaired. All right, next up on page 459, under eyelids, we have procedures for eyelid conditions such as blepharoptosis, also known as drooping. So what you're going to see over here, blepharotomy code 67700, that's where they make an incision into the eyelid to drain an abscess. And then we also have our blepharoplasty codes, which are 67916, and that's on the next page. 67917, 67923, and 67924. Speaking of those codes, what I want you to be familiar with. If you look at 67914, you should highlight the word ectropion. Whereas 67921, that's entropion. I do want to note that there are some blepharoplasty codes in the integumentary system 15820, 15823, And the code selection is really going to be based upon the technique that the provider actually uses for the repair. Of note, because we're talking about eyelids over in this area, don't forget about your anatomical modifiers for eyelids. So that would be E1, E2, E3, and E4. All right, guys, almost done. We are now going to go over to the last area of the 60,000 series, which is the auditory system, starting with code 69000 through 69979. And first up, we're going to go to page 466. And what we're going to look at here are procedures on the external ear. And I want you to notice the first code under incision says drainage of external ear abscess or hematoma simple. I want you to notice 69020 also says drainage external auditory canal, but what does it say? It's an abscess. All right, other things I want you to notice here, we have biopsy of external ear versus biopsy of external auditory canal. So what you want to be careful about here is it the external ear or is it the external auditory canal? And then we also have procedures for excision of the external ear, 69100. Oh, I talked about that already. 69110, and then 69120. And those are divided based upon if it's partial simple repair versus a complete amputation. All right, next up, still on page 466, we have codes for removal of impacted earwax. So I want you to note, we first up have 69209, which is a code that says removal impacted cerumen using irrigation or lavage. It is a unilateral code, so if they do both ears, you need to put a modifier 50 on that code. Now, we also have 69210, which is also removal of impacted cerumen, but it requires instrumentation. There are lots of subsection notes below 69210. Make sure that you take a list or look at those codes. All right, next up, on page 467, under middle ear, you're going to see some procedures that I'm sure you've heard of, starting with 69420, which is a myringotomy. Myringotomy is an incision into the tympanic membrane to relieve pressure and pus. Now, I want you to notice that myringotomy and tympan, both of those words mean eardrum, but I want you to notice the difference in the codes that we have available. So 69420 and 69421 are both myringotomy codes, but that second one requires general anesthesia. Then when you go over to 69424, this is when a patient has had a ventilating tube inserted, and today they're actually removing that ventilating tube. Then we have 69433 and 69437, which are known as tympanostomy, and those guys are divided based upon the type of anesthesia. So tympanostomy you commonly see in patients that have chronic ear infections, and so they're inserting those tubes in to drain that fluid. So I've actually already talked about this, so I'm going to move on. Cochlear device, page 469. So on page 469, you see the code 69930, and that is the code for the cochlear implant device. Now, the reason I wanted to mention this code, because there's only one code here, but throughout the surgery section, you actually have seen different codes for inserting different devices, and those are devices that will need to be monitored. And so you probably are wondering, well, how do we get paid for actually monitoring those devices? And those codes we'll actually talk about in the medicine section of the CPT manual. All right, guys, and the very last code for the 60,000 series surgery section is the operating microscope. Now, as it relates to the operating microscope, the first thing that you should note, it is an add-on code. And as you know, add-on codes cannot be used alone. On page 470, you will see a list of codes that you cannot report the operating microscope with because it's already included in the code description. All right, guys. Well, that has been the 60,000 series for the surgery section. Next up in our series is the 70,000 series, which are the radiology codes. Thank you so much for listening.